So picking back up, we were talking about behavioral techniques, and I was mentioning flooding. When we get flooded with a stimulus, we basically it's the opposite of systematic desensitization. If you want somebody to get over fear of bridges, you take them over the causeway and flood them with it. Or if you want them to get over their fear of dogs, you take them into a kennel full of dogs. And obviously, there's ways to help them with being able to calm themselves, being able to use self-talk, and you coach them through this, but it can have bad effects too. Adversive conditioning, different forms of like antabuse is used as an example of adversive conditioning, a drug that when you take it, if you drink alcohol and it makes you nauseously sick. We talked about this in chapter 5. Opera conditioning techniques, applied behavior analysis. Also forms of changing behavior. We use applied behavior analysis, APA therapy, with autism and autism spectrum disorders, and it's a great way to almost rewire the brain for adaptive kind of behavior, and an excellent choice of therapy for kids that are diagnosed with autism early on. It should be essential. You can see the desensitization hierarchy, and I won't spend time here, but this is how you kind of walk somebody through. And this example over here for somebody that has test anxiety, here's some processes that you would walk them through by desensitizing them. Cognitive therapies emphasize thoughts as the main source, so we're trying to, the premises is that there's distorted thinking, and we need to identify the distortions that somebody uses and then restructure their thinking, changing the pattern of thought presumed to be causing the maladaptive emotion or behavior. So basically, we have thoughts that are out of whack. My thought is it's all or nothing kind of thinking. That's the distortion. And so I see a situation, I'm not doing well on a test. I start to think this is it. I'm going to get an F. I'm going to have in the course. I go all out with it. Distortion. So challenging the distortion, trying to help people put it in perspective and see that it's not all or nothing. And if we can help them do that in the moment, then they'll be able to reduce their anxiety, reduce their fear, or even increase a mood state where it's depressive kind of thinking. Very cognitive therapies have really been proven to help, and then we combine behavior with it, and we have cognitive behavioral therapy, and it's been proven to be the best form of therapy. Albert Ellis, rational motive therapy, was a form of cognitive behavioral therapy, and basically he said emotional reactions to life events are a product of irrational beliefs and expectations, like I've been talking about. Central false belief that feelings cannot be controlled. They can be controlled, so we have to help somebody realize that they can actually do that. Masturbating, I must do this, I must do that. And if you look down here, it talks about I absolutely must perform well and win the approval of other people. Number 2, other people must treat me kindly and fairly. And number 3, my life conditions must not be frustrating, but rather should be enjoyable. These are things we need to help people change and realize that I can control some of my thinking in this, which will help with my emotion. And Albert Ellis was direct, and his style was much more confrontational, and he was an interesting guy. He was the opposite of this guy Beck, who was much more soft and supportive in the way he approached. Same kind of premise, though. We're looking at irrational thinking, just a slightly different way of going about doing it. And you can see Beck's cognitive therapy here. Since Aaron Beck's method stresses that the goal of therapy should be to help people to recognize and eliminate illogical, self-defeating thinking. I use quite a bit of this in my therapy, and I really like Beck's. I also like Albert Ellis. I think both of them were on the right track, and like I said, research has really shown that those are effective therapies. And then we combine them, we bring them together, and so we use cognitive therapy for reducing the self-defeating thoughts, and then we throw in behavioral therapy to change the behavior. And with behavior therapy, we'll use homework assignments. We'll put them in situations where they're going to have to work on reducing the self-defeating thoughts in the moment, and then make behavioral changes. So it's when you bring them together, it can be a very powerful form of therapy. Cognitive behavioral therapy, self-instruction methods, teaching to modify your own behavior, using reinforcing self-statements, take positive steps. Nowadays, there's some good apps that you can download, and therapists will actually use these apps with their clients. so they can get real-time information about what's going on in their lives. You can't follow a client around 24/7. So you can have them report in on the other apps and have them actually do the challenging, the thought-challenging work wherever that environment is that causes the problems with their thinking. And then you get quick text and quick emails to you. And then you can use them when they come to therapy, because you can use that information. It's much more reliable than their memory of what happened that week prior. So really good stuff going on with cognitive behavioral therapy. And we use it for anxiety disorders, mood disorders. Yeah, limited use with schizophrenia. I think the medication part has to be stable first with schizophrenia. Then you can use some cognitive therapy. Personality disorders, we use the cognitive work there too. With borderline, for instance, we're helping them so they don't split in their thinking. We can help challenge the thinking that causes them to split off and go to all or nothing, or I hate you, please don't leave me kind of stuff. Here's some comparisons. I'm not going to go through these, but it gives the different cause of the problem, therapy emphasis, and the nature and therapy of the different techniques. And you can read through this on your own and see the differences. This comes straight from your book. Therapy integrations, integrating, we try to come up with the right type of approach. And most therapists are eclectic. They integrate different forms and different modalities. We tailor make therapy for the client or for the patient. You can't cram a certain type of modality. We can't make cognitive work on one patient or make a humanistic approach work. We have to use from different modalities, different forms, different perspectives. And then you've got the dialectical behavioral therapy used for borderline personality disorder. This is really effective for personality, for borderline personality disorder specifically. And you're using a variety of techniques here as well. Conceptually compatible with the biopsychosocial model, because we're dealing with physical aspects, we're dealing with the psychological, and then there's social worlds. Sociocultural approaches, we're going to look at a few different ones. Group therapy, for instance, individuals sharing psychological disorder brought together in sessions. I think this is underrated. I think group therapy is powerful, and I think there's not a lot of opportunities. Resources in our community are kind of limited. In the greater New Orleans area, especially post-Katrina, we don't have a lot of group therapy opportunities. When you do, and if you can find the right kind of group, it can be really powerful. And sometimes I think it's more beneficial than individual therapy. And you can see some of the keys there, the 6 features that make up make up group therapy. But in my estimation, sometimes I think people would benefit from group more than individual. Family therapy, I do a lot of this. Group therapy among family members. This is challenging work from a therapeutic standpoint, but very powerful. I think we have families come in, and usually they'll come in and there's one person that's the identified patient. They're like, change this person. But when you work with a family and you start to kind of understand the dynamics of the family, you see validation, reframing, structural change, detriangulation. These are all examples of things that we do in family therapy, whether it's strategic structural therapy or it's family systems therapy. You can watch the nonverbals, you can watch the movements of people, and you kind of insert yourself in as a therapist. And you don't want to undermine the power structure of the family. You want to come in with the power, with the executive power. Sometimes that's the mom, sometimes it's the dad, or it can be one of the siblings. You identify it, you come in sort of aligned with them because you don't want to disrupt it at first. Later, when you're working with this family, you're going to disrupt the system. And the idea is that you want to mess up their equilibrium. You want to destabilize it in a sense, with the idea that it'll settle at a higher level of functioning. It's complex, it's challenging, but if you can get the families to buy into it and see how it can actually make a change, sometimes they're up for it. But it's challenging, especially to get all the members involved. Some people don't want to be involved, and they feel like I'm not part of the problem, but they're part of the family, and they're affected. It's kind of like It's kind of like I think a mobile, like everybody's hanging from a little piece, but they're all connected. So if you thump one piece of the family mobile, everybody is affected. One moves away, one comes close. They all have their roles and unspoken roles. One person's the comic relief. One person is always in the conflict. Always, or one person might be the rescuer, or one person might be the referee, or all these different roles that play into it. Couples therapy, listen, the research is still lacking. Couples therapy, it hasn't been around as long as you think it has. Um, there's it could be beneficial, but I think you got to find the right kind of therapist. And be honest with you guys, there's only a handful of people that I think are good couples therapists in my community. I live in St. Tammany Parish, and there's just a handful of people I think are good at it. I think a lot of people say they're good at it and they try it, but it's very, very difficult. I'm taking about a 10-year break from couples therapy because of I want to get more training to where I'll be more successful working with couples. Um, they're tough, and couples sometimes don't come in at the right time. They wait and make it's a last ditch effort. They already have attorneys on retainer, and you're like, you guys should have come in about 10 years ago. So again, if couples really want to change things, they need to get on it when problems are starting to happen. Kind of like getting an oil change for your car on a regular basis. I think couples periodically should get some work done on their relationship. If they wait too long and it gets shoved under the rug for many, many years, then you're dealing with some tough stuff 10, 20 years into it. I'm going to go past. Self-help groups are really good. They're out there. They're available. Self-help support groups. AA is a good example of something that's worked for a lot of people. Um, and I know there's different types of groups. Some are open, some are closed. You can find an AA group in any community in the United States, maybe in the world. They're out there, and they do good work. And they're not perfect, but they do help a lot of people. Um, Community mental health was born in the 1960s. Individuals with disorders ought to remain in the community. I think so too. Deinstitutionalization was to get patients out of long-term psychiatric care and get them into outpatient facilities, get them into grassroots movements, get them into nonprofits that we're trying to help. I've seen this be very effective in some communities, and we lack this. And I know it gets cut from, we're talking about budget cuts right now. Mental health gets slashed all the time, and it is a shame because outpatient services, I think, make a bigger change sometimes, and it gives people meaning. It gives them a sense of hope. One last thing I want to look at, guys, I'll move past. You can read about cultural perspectives, collectivist societies, ethnicity, gender does factor in. Effectiveness. A large body of research points to the conclusion that psychotherapy works. Researchers have carried out hundreds of studies examining effects of psychotherapy. The strategy used is a meta-analysis in which researchers statistically combine the results of many different studies. Although research confirms that therapy works, no single therapy has been shown to be better than others. It depends on the person, depends on the family. Therapy benefits individuals with psychological problems at least through the first 6 months of treatment and possibly longer. Also, you can look there. It gives more information about some of the research that shows that psychotherapy is beneficial. But the payoff, if you look here, it's many sessions down the road. So it's about a third of individuals recovered by the 10th session, 50% by the 20th century, 70% by the 45th. If you're looking to get great benefits in the first 5 to 10 sessions, you might be disappointed. That's why people need to stick with therapy. If you get the right person, sometimes you go to a therapist, you don't click. Don't stay with them. Go to somebody that you're starting to feel some comfort with. But you have to know some of the psychological forces are pushing you away from that because psychotherapy is not fun. It's not easy. It's painful, but it's a process that if you stick with it long enough, if you're with the right therapist, the right kind of treatment, it can really pay off. Now, I know I'm biased. I do this work, and I don't think therapy is for everybody, and we all need to jump into therapy, but I'm a believer that if you get with the right person and you put in the work, you meet them halfway, you collaboratively work, it can be very, very helpful. Here's some of the health and wellness benefits that therapy has, and I'm not going to go into the wellness benefit therapy. Common themes, client factors, quality participation. It says participating therapeutic outcomes if the client, him or himself, the quality of the client's participation is chief determinant of the therapy outcome. So the client has to put the work in. And there has to be a good therapeutic alliance here. They have to be trust is at the core and acceptance, and it can pay off. So anyways, that's pretty much all of chapter 13. So I'm trying to think if there's anything else that comes up. I'm a believer in mental health. I just think that sometimes it's a struggle.